Hi, guys, and welcome to the Rare Wellness Podcast, the podcast designed to help you heal holistically and give you the tools that you need to thrive. We're making it easy to understand medicine and wellness with practical steps from the experts, one podcast at a time. The only thing that we ask is if this podcast helps you live just a little bit more aligned, that you leave us a review and that you'll share with a friend. That's all that we ask so that we can continue to provide you with free, valuable knowledge from the experts of well-being. Today, we are going to be talking about movement as medicine. Most of America is just pushed with pills with no regard to their lifestyle and not even asked about, can these diseases that you have be treated, prevented, and sometimes even reversed by just changing how you live or looking at the root cause. The greatest medicine is movement, and I'm so excited to be interviewing Dr. Justin, our guest today. He was born and raised in Spokane. He has a health science degree from Whitworth University, where he also played baseball, and he completed his doctorate program at Palmer University of Chiropractic West in San Jose, California, and started Built to Move Chiropractic and Sports Rehab in 2018 with the goal to bridge the gap between healthcare and fitness, to challenge the greater Spokane community to expect more out of their providers. So, Dr. Justin, thank you so much for coming on the podcast. I'm really excited to talk with you today.
No, thanks for having me. I've been hearing a lot of good things about this podcast, so I'm lucky to be part of it.
Yay. Well, let's get right into it. So, I guess before we get started, I ask every guest, what does wellness mean to you?
So wellness for me, I mean, being a healthcare provider, it's having the freedom to kind of move your body how you want to move it. A lot of as we age, stiffness and you wake up with aches and pains, and that's kind of the sign of aging, right? So wellness is like being able to do the yoga poses, go to the gym and work out and move the way you did when you were younger, and still being able to do that as you age.
No, and it's such a luxury, and it's something that you take for granted until you can't do it. And so yeah, absolutely. I love your definition of wellness. So,
Totally. We take a movement for granted, right? It's
mhm.
like, oh, I used to be able to pick things up, and then yeah, now I need help doing that.
I know. Yeah. So to get right into it, can you kind of just give us a little introduction on what you do, what your philosophy is, and how you ended up getting to movement as medicine? And yeah, give us a little background on your philosophy with all of this.
Yeah, so I'm a sports chiropractor. We do a lot of movement-based therapies. We do a lot of manual therapies as well, but a lot of our manual therapies like deep tissue work, trigger point therapy, cupping, scraping. We do all those things to try to help our patients move better with that goal in mind. A lot of our patients actually do a lot of like CrossFit, like they're very active. They love to go hiking. We see a lot of weekend warriors. So a lot of our treatments incorporate movement as the biggest component, and trying to teach them consistency. Consistency is the biggest key to the success in our treatments, but also and just life in general, right?
Absolutely.
We're creatures of habits, right? Getting that routine.
I was talking to it was in a different episode with someone else, but it was the same concept of like, okay, so it's like going to the dentist one time a year and not flossing, not brushing, and expecting yourself to have good teeth because of one cleaning. It's like the same thing. Imagine, you go to your chiropractor, you go to your provider once a year, and they give you this great treatment. But if you're not consistently doing it, how do you expect it to show up in your body and all the
Oh,
benefits?
totally.
Yeah.
One of the biggest things I see is, oh, I hurt myself doing this. I was like, oh, it wasn't the 95 other things you were doing that led up to this, right?
Right.
That one movement was the straw that broke the camel's back, right?
Right.
And I see, I want to say 80% of my patients are maintenance patients. And they generally range between 3 to 4 weeks apart between visits. And I talk about like student loans, right? It's probably like it's nicer to see a lower total at the end when you're done with school, right? If you chip away at it through the school year versus oh, I'm living life, it's great, I'm not in pain, and then all of a sudden, boom, oh, I get an MRI, I should probably need surgery, and I have
Absolutely.
a lump sum of money I owe.
So before even diving into everything we're going to talk about, do you have to be sick? Or I guess what I'm hearing you say is that you can go, like, people come see you before they get hurt, and that's actually the way you should do it versus waiting until you're like injured to start taking care of your body.
Totally. Yeah, prehab is a big component. You look at our healthcare system. We are so conditioned to think, oh, I only go in when I'm sick, right?
Mm-hmm.
Like, I'm going to offend people, but our wellness checks annually is kind of a joke, right? Oh, take your blood pressure, come in. Oh, you're not sick. You're not like what? I can go buy a blood pressure cuff on Amazon and I can check that myself. So like, what does wellness mean to like the community as a whole? And so, yeah, taking care of things and even education on what you're about to go do. You want to start hiking? Okay, cool. These are prerequisites of your body that you need so you can hike and to hike well without getting hurt. So, teaching people how to not get hurt, how to bulletproof their bodies so they don't get to that significant injury.
Yeah. Man, I love this. And I'm thinking about how many injuries I would have saved myself doing by
Oh,
doing
yeah.
this first. So,
Same here.
yeah.
You're just
Uh,
like, I wish I had the treatment that we're giving people when I was playing college ball. And it's
yeah.
like, what?
No, I'm so excited that you're offering this. So, I guess what are some signs of body dysfunction that we should be aware of to prevent pain or issues? Like, how do I know I need to come in and see you?
So we often look at pain as an indicator of like, oh, something's going on. Like, let's get it before it gets bad.
Yeah.
But the second you feel pain, it's already too late, right? Things have already been set in motion. And so now we're going through the phase of, yeah, we need to put you on a treatment plan. Let's try to get this pain out as fast as possible. And what's the main focus of it? Well, when you're in pain, you move like crap. So did you even think about how you were moving before you were in pain? And so looking at how you're moving, if you wake up in the morning, you're like, man, my back's stiff. That's not normal. And different variances of that, where,
Yeah.
if you had a certain event that you did, and like I'm gonna go backpack across the country, you're gonna be stiff, right? So like that's a normal variance. But if it's you haven't changed your routine, you haven't done X, Y, and Z, right? Stiffness and soreness and tightness, that's all a kind of like leading factor to how you're going to be moving, right? If it's harder to bend over to put your sock on, okay,
Yeah.
let's think about like, okay, either stretching, like
Yeah.
let's get to the gym and move around, go on a walk. And if it doesn't get better there, let's get some help.
Well, and beyond that, I think there's so much value in going to professional and getting advice for all of this, because it's hard to even address some of these issues if you don't even know where to start. Like if you don't
Oh,
know what
totally.
stretches you should be doing, you don't know what movement is the best for the issues that you're facing. Yeah.
Yeah, it's not all bodies are built equal. Stretching's like the number one go-to thing for most people. You look at some of my toughest patients were former gymnasts, right, or cheerleaders, anything that involved a lot of. Oh yeah, no, I was gonna say,
No, my body's
uh,
broken.
right. And so
Yeah.
when you stretch, you already move better than 90% of the
Yeah.
world, right? And so you're like, I'm not getting any relief. Like, why am I not getting relief? Well, you're probably hypermobile, and so we need to work on some heavy slow resistance training, right? So let's load your tendons, load your joints, and help you get better that way versus someone like me, I'm stiff, right? I
Mhm.
used to lift all the time. Mobility was like an afterthought because when you're younger, you're like, I'm invincible.
Mhm.
I don't need to stretch. I don't need to do anything. I don't
Mhm.
feel pain. After a torn ACL, torn pec, meniscus is all destroyed. It's like, oh, I should probably do something differently. So
Right.
change your routine and adapt to how my body is now. And you'll see different variances of that where I take a super, like CrossFitters are great examples. Like they're super buff, they move really well. Okay, how do we get you out of pain, right? And it's this combination of everything. So it definitely helps getting in with a provider that we take pride on doing what our patients do, so we get a better understanding of how to treat them.
Yeah. No, that's so good. And I'm now realizing I need this, so I'm going to be putting
Right?
this on my list to come in and see you. But yeah, so let's talk about range of motion as a tool for identifying potential pain. And can we talk a little bit about that?
Yeah, for sure. Typically, if you have normal stretching routines that you're pretty good about, use that as an example, right? Bending over and touching your toes, which that's mostly a stretch for your back versus your hamstrings. But and some people are just clueless, right? You can go on Google. You can, if you're a former athlete, you can do the same things and just go to the bank of exercise that you know of and just practice that daily. Because if you just do something consistent, you're probably going to feel better, but also you have tools. And so a lot of the rehab exercises we give are tools that they can do daily and use this as an assessment, right? Stretches are not just like pain relief. It's an assessment tool to help you kind of identify, oh, this is tighter today.
Right.
Let's really focus on that.
It gives you a benchmark that you otherwise wouldn't have if you're not moving your body at all and you're totally disconnected. How are you going to know? Yeah.
Right.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanethealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanethealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on premium intimate yoga studio with a therapeutic emphasis, bar classes, tai chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massage or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. So how do you approach, I know so many people talking about being disconnected from your body. Many of us think we feel fine, but our bodies show otherwise. So
Right.
how do you approach patients who come in and they're like, this is normal, this is fine, but their bodies are telling you that they're not okay?
Yeah, so it's kind of that numbness, right? We live in a go world where your subconscious is probably the biggest indicator, right? No one ever talks about stress. Oh yeah, it's just stress, but the stress and the cortisol levels it releases that tenses your bodies, right? Females more so than males, but you look at having that conversation, just sitting down. It's like when I ask you how are you feeling, it's like not just how your body's feeling, how are you doing mentally, right? Because if you're kind of wound up and you're like feeling guilty, I shouldn't be here because you're not making time for yourself. It's like self-care isn't a luxury anymore. It's a necessity to help you be do your job better, be a better parent, and yeah, I mean it's crazy, like seeing just how much you need to move your body, and how that relates to your stress.
100%. And it's all connected. It's like you can't, yeah, your mind and body is so intertwined that it's like, how do you separate it? Can you explain the concept of treating your lifestyle as a sport?
Yeah. I always, instead of calling them patients, right? I mean, that's part of the environment we're trying to create. We don't want people feeling like when you step into our clinic, it's super sterile, like you're going into a hospital, right? And part of that's like we do technically call them patients. They're patients, right? We're all doctors, but most of our patients are active, so I like to call them lifestyle athletes. And so, we see a lot of the people who have a sedentary job, like accountants, attorneys, who are dialed into their computers all day. And then what do they try to do? Oh, I got to make up for 8 hours of the day with the 1 hour, right? So I'm just going to beat the hell out of my body, and I'm fit.
Yeah.
And so trying to find the balance there. And when you look at sedentary jobs, like looking at an accountant who's able to sit in the computer, he can probably do that longer than I can, right? I get to move around daily, right? And so he does that better than me. So you can take that as a sport, right? Same thing with contractors and laborers. they're in the profession of we just got to get stuff done. You know,
Mm.
if you're on your hands and knees for 6 hours straight, you just got to get it done. So
Mm.
realistically, like that's a sport, right? You're
Yeah.
doing something that's stressing your body for a period of time, right? Every day, people who go out to work out, like if you're working out 5 days a week, that's what I did in college. I worked out 5 days a week. Like, why do you not feel like an athlete if you're doing that, right? And so we always downplay everything we do because we're not in a official sport.
Mhm.
But no, you're an athlete, right? You're training to go hike. You're
Life
training to
is
go.
life is your
Yeah.
sport, life is your arena, and like you are the athlete.
Right.
I love framing it this way. I think it also like romanticizes life a little bit and makes it more yeah, I mean it makes the way you approach it like, well, if I'm an athlete and I know I'm going to be competing in a game, I'm going to be fueling my body beforehand, like I'm going to be paying attention to that. And so being able to apply that in the arena of life as well, of like, okay, like if I view my day-to-day activities as I'm an athlete playing the game of life, I'm probably going to start approaching the way I take care of myself in a different way too, so I'm
Oh,
equipped to do it. Yeah, no, that's
totally.
so good.
You look at the other components outside of just the physical, like mental health. Like, am I too
Mm,
stressed out right now? Am I taking time for
mm,
myself? Like, do I need a break from this? What am I putting in my body? Am I letting my body rest? Right. You know, there's so many times where working out is a stress reliever for a
mm.
lot of people, but if they're just crushing it, and like they feel over like stressed, and what's your recovery to workout ratio?
Yeah.
Like, are you actually recovering for the workout?
Well, and I know that just from my own personal experience, for years I was like, I thought health was killing myself. So I was like, I was working out, I mean, 2 to 3 hours. It was so unhealthy. This is, and I'm well aware of it, but like I was I was working out 2 to 3 hours a day, like, felt guilty if I was taking a rest day, and I saw but my cortisol levels were so high, my acne was so triggered because I'm very sensitive to stress on my skin, which stuff I found out later, but I was holding on to more weight even though I was working out so much, and in the last 2 years, when I started allowing myself to feel rest and I actually started prioritizing like just lowering my cortisol, lowering my stress, and it was for anxiety, for mental health, but my body reflected the changes. And I also know that there's differences between like people and women and men and
Right.
whatever, but
Right.
like for me, I love what you're saying, and it resonates so deeply with me because I didn't realize part of playing the game well, part of being an athlete is rest and lowering the
Right.
yeah.
Well, it's that old school method of toughness, right? You
Hmm.
know, you're like, oh, work harder. You should be throwing up after like your workouts. And I mean, I went through it, right?
Hmm.
And after when I got into grad school, I was done being an athlete. We don't have a training room anymore. I put on some weight, and you're like, God, this is so unhealthy. So trying to backtrack that, I get the skin sensitivity too. I get eczema, and so that's partly why like you create this like chill nature of you,
Yeah.
because you have to stay like keep that stress down, and then keeping your body moving enough to meet your needs. And what does that look like? And most people are hard on themselves when they go through that point where they're like pushing too hard, but you need to learn, right?
Hmm.
There's no I always tell people too, like inside the gym, there's no bad movement, there's just bad intentions,
Mm.
right?
That's so good. So let's talk about consistency. I know we've hit about this a little bit, but like, why is consistency the key to health and well-being?
Oh, I mean, that is a good question, right? Like in anything, you look at like I compare it to like the stock market, right? If you're getting subtle increases, that's where you can have that mental component of like, oh, if I do this daily, small changes will make big changes over time, right? Versus looking for I'm trying to lose 30 pounds in a month. You're like, all right, well, that's not sustainable because you're gonna probably get it back because you're doing unhealthy habits to get you to that point, right? You're banking on Bitcoin to shoot up,
Hmm.
which apparently I had. Someone told me that. I was like, okay, well, you're riding the high right now.
Yeah.
But
Yeah.
yeah, and so small changes over time make lasting changes versus looking for that big home run, right? You're like, oh, if I can lose this 30 pounds in a month, I'll be set for life. Well, that's like, well, can you, like, has your body adapted to that, or has it adapted to that crappy diet, and then you're going to crave whatever you gave up? And so small changes over a long period of time will create
Compound.
lasting. Yeah.
Yeah.
Yeah. Compound
Ab-
interest, right?
Absolutely. Bouncing back to managing stress, what
Mhm.
advice do you give to patients about managing their long-term stress?
Deep breathing exercises. I typically give the box breathing. That's something that helped me kind of really kind of control my stress a little bit, especially when you get anxious. And just journaling.
Yeah.
If you can journal stuff like stressors down, and then sometimes in practice deep breathing as you go through it, because it's stressful. Like writing it down, looking at it, and you're like, oh, that's stressing me out. But then practice deep breathing, and then go through the thoughts of, okay, students, I have this paper due in 3 days. Like, oh God, I have a paper due in 3 days. Breathe through it, right? You're gonna get it done, but it seems overwhelming over time. And whether that's like feeling okay, like can I be productive? I'm one that I have to like put like a time crunch on it,
Same.
or else if you give me 2 weeks, I'll wait till like I'll
The
I'll
day
give it
before.
13 days, yeah, right, just to have that pressure, right? So
Yeah.
during that whole time you're stressed, like leading up to it, thinking about it 2 weeks from now, take an hour out of your day, go on a long walk, breathe, enjoy. Like it's sunny now in Spokane, so that's
Mm.
great. Just go enjoy it. So not feeling guilty, because if you're a procrastinator, you're gonna wait to be stressed about it anyway. So if you know that's gonna happen, you might as well prepare and take the time to decrease the stress and then
Absolutely.
prepare for those moments, right? But also don't procrastinate.
Yeah. No, that's so good. I love again that when you're treating your athletes or your patients or there's this holistic approach of like, yes, it's your body, but it's also your mind. And back to the journaling thing, I've just noticed that for me personally, since I started journaling, it there's a level of power there's a level of power that your thoughts hold over you before you write them down, because in your head they can sometimes feel a lot bigger or distorted, and when you put it out on paper it's like, okay, hold on, in my head this is all consuming, and in real
Right.
life it's just this one thing, I'll be okay. So how does the type of movement change from person to person? Why shouldn't someone just look up exercises and movement to do online? Why do you cater individual treatments to, or why do you cater treatments to each individual? And why should someone come in to see you or someone else like you?
Right.
Yeah.
So, I mean, taking like you for example, you're probably super hypermobile,
Very.
right? You have the gymnastics pass, and you'll probably look up, oh, this stretch will help relieve my back pain, and you've probably dealt with, I don't feel the stretch here. Okay,
Every time. Every
every
single
time,
time.
right?
Yeah.
Because you're too mobile for that stretching, and so your muscle fibers, your tendons, they need to be adapted in a different way. So I wouldn't be stretching you that much during our appointment. It would be, we'll go through some soft tissue, we desensitize your pain areas, and then I look for like the small movements, right? Because you're athletic enough where, okay, your pelvis should be tilting like this for, like, let's say your low back,
Hmm.
right? And look for signs of, if you squat, do your hips pinch, right? Or what does your squat look like,
I'm just realizing talking to you how much I need this, and I didn't, because I'm like, my
right?
body, I'm 22 years old, my body is already deteriorating. I'm like, what is it going to be like
Right.
when I'm 40? This is so bad. So
Yeah,
yes,
yeah. I'm
absolutely. Yeah.
hitting it there too. I've ran through the Thunderdome of, okay, you treat your body like an amusement park, and you're like, okay, now I need to take a step back and look at that, right? And looking at, it's funny when we're training, the stuff we don't want to do is the stuff we need to be doing. I hate running. Like, I was like, playing football in high school, baseball, like those are all stop and go. Like, so if you told me, I still think a mile run is like long distance. So, changing your body to adapt to you now, right? And
Mm.
so, where our bodies were when we were like, 18, they fit where our lifestyle then, but
Well,
maybe not now.
Well, even like for me, to give you some context as well, like since quitting gymnastics and doing all of that, like I got really into extreme sports. So, but
Mhm.
I partially dislocated my shoulder last year, tore my
Yeah.
labrum, have like torn my ACL. I've had like broke my wrist. Like I have too many surgeries at this point,
Right,
and it's
right,
yeah, it's just like, man, like I felt like I was invincible when I was a kid, but sometimes that hypermobility becomes hard as well when I go in to see a doctor and they're like, well, you have full range of motion, so they'll overlook, like they won't even test me, they won't even like test, like give me an MRI because they're like, well, you can move it all the way. And I'm like, I swear
Right.
I'm in pain. So
And
it's,
that's
yeah.
and that's where the range of motion comes in, right?
Yeah.
You have good range of motion, but is he move like are you actually controlling that range of motion, or are they doing
Right.
it for you? Because then that's the difference between flexibility versus stability, right? Stability is how much control do you have over the range of motion, and with gymnastics you need a lot of like both. You have to be flexible, but you have to also be stable. Like getting on your hands, breaking a wrist, and then having multiple surgeries, like in our head, oh, if I get that surgery, I'll be better.
Right.
Okay, well, your round of PT is not going to do it. That's
Yeah.
almost life, right? You had someone open you up,
Yeah.
replace things, cut things out, tie things together, and then you have to rehab that. A lot of what we see is post-surgical scar tissue. And this is after we always recommend PT. We work a lot with a lot of physical therapists to get them back, and then we kind of take over after that to see, okay, how is the scar healing? We do a lot of manual therapy here, but we also make sure we get the very specific rehab.
Do treatment centers like yours, are they common? Like, do you see them a lot, or is what you've built pretty unique?
It's pretty unique for Spokane. When I started this in 2018, it was just me, and then my wife joined 2 years later. Because we didn't know how this was going to work out, so she provided stability for us while we try to grow this together. So we got this idea from seeing what the most successful clinics in big cities like the Bay Area, LA, San Diego, all those big cities, what do they do well, right? And in Spokane, we're already 20 years behind on everything, right? So some of these buildings, I'm like, that's gonna just fall down at some point. And so we wanted to bring something like that from the big cities when we were in school to Spokane and give back to the community and say, hey, this is chiropractic done well and with our full scope of practice. And you don't see that in Spokane because we're so insurance based here, right? But as Spokane grows, people are becoming more used to private pay.
Which we just did an episode on, so if you're listening to this, go back and check it out, but about the traditional cost of, or the cost of traditional healthcare and then versus some of these alternative therapies, and how sometimes things can seem more expensive in the short term, but in the long term, it's actually going to save you a lot of money, because if you can avoid some of those surgeries down the line. And beyond that, I'm such a firm believer that a lot of people don't get the results that they want because they're not willing to invest. And again, I've talked about this on previous episodes, but regardless of if it's in your career, you have to invest in good education or invest in a good mentor to get results. If you're with your finances, if you want to make money, you have to invest money. Right. And if you, it's the same thing with your health. If you want to see results, you have to invest time, you have to invest
Totally.
money. Right. So it's yes.
I always ask people how do you want to retire, right?
Mm-hmm.
Do you want to live the way you were in your early 20s and 30s, where your body's moving well, you can hesitate, oh yeah, I'll go on a hike with you, or just beat your body up, not invest anything into yourself, and then, oh well, I'll just get the surgery, I'll just get back surgery when I'm older. Well, what does that entail? That's it's 8 to 16 weeks. You're 65 now. You don't heal as quick. Your muscles are frail. Were you strength training the whole time? And so then your recovery process sucks, and you're giving up years when you have less years to give.
Let's talk about surgery for a second. So can you just share some common misconceptions about health and wellness? So some people believe surgery fixes everything.
Totally.
Yeah.
So I'll be the first person to tell someone that they need to get surgery, and if I say you need to get surgery, that's pretty serious.
It means you need to get surgery.
That means you need to get surgery, right? I'll work on a lot of things. For me, I tore my pec, had a full tear. I missed the window to get surgery.
Sounds painful.
Right before my daughter was born. So I was well, I want to hold my daughter and be able to help out my wife. And so I didn't get surgery there, but now I'm dealing with, for me, it was they told me it was mostly aesthetics. You can still have full range of motion. And I rehabbed it, but now I deal with kind of chronic, shoulder blade pain and stuff like that. But yeah, the surgery, if you need it, you need it. But I always tell people like it's not the one solve fix
Yes.
because you're having someone open you up, you're having things put into you, right? And like the science today is
And they're
unreal.
foreign objects. Like at the end of the day,
Right.
it's not your body. Yeah.
Yeah, there's that risk of infection, and like the surgeons here are all amazing in Spokane, but it's just like there's that window of once you're done with the surgery, they patch you up. You kind of go through the same thing. Oh, post surgical PT, and then oh, you're off, right? Well, the assumption is that I'm good, right? You don't look at potential like let's say shoulder dislocation or labrum tear. There's trauma in surgery too. Sometimes they have to open that joint up and like
Yeah.
dislocate it again and then put it back. And then you go through the PT and it's probably some banded stuff, and the PTs here are awesome as well. But then you think you're good after that. You have a lifetime of just, daily exercises that, it's easy to fall in the life of, I don't need those anymore. I graduated PT. They said I'm good. That means I'm good. It's just like you're going to be more prone to re-aggravating those resets. So it's not a one-solve fix. It can be. It can help escalate the process of getting better, but it's just going to take time, and then you have to be consistent again about it because you're prone to it.
And yeah, I'm actually really excited because and again, for everyone listening, I've go check out our previous episodes, but with new therapies like that, like bone marrow concentrate and PRP and like stem cell stuff that Jamie does. So that's actually, I was told I need surgery on my shoulder, but I ended up doing that bone marrow concentration and PRP instead. And I'm on a month and a half right now. My stability is starting to increase. I'm just about to start PT, but I
Yeah,
feel so good. And it's really exciting to know, if surgery ends up being the route that someone needs to take,
yeah,
there's a time and place for everything, but like it is
totally.
so exciting to just honestly, for this podcast, like the goal is like to give people awareness that like you have options. You can also, even if you don't need stem cell or PRP or whatever, like you can, or regenerative medicine, even with some of this preventative stuff, like you can use movement as medicine. You have options, and just being aware that like it's not, I think there's a little bit of, it's a business as well, and there's a little bit of misconception of like every time you're hurt, the first thing is, and I mentioned this in the intro, which was a little bit off, but like, the first thing doesn't have to be pills. The first thing doesn't have to be
Right,
surgery. Are those things viable options when you need them? Yes. But should it be your go-to every time? Probably not.
right,
Yeah.
right. And because yeah, you look at injections. The orthos are very upfront about it. The more you get them, the less likely like they'll be effective, right? And the cool stuff that Jamie's doing with the PRP, bone marrow, and that's all like pretty like new stuff, and it's awesome. And even with that, it's like a non-invasive like surgery route. It lets your body heal inside. And so going back to movement, right? I mean, just looking at your shoulders, like,
Mm-hmm.
what are your scaps doing, right? You don't have to be like upright sitting
Right.
like this. But it's like, hey, can you pull your shoulders back without like moving your shoulders?
My posture
Yeah.
is so bad.
And so, I mean, we live in a tech world, right? Everything's
Yeah.
here, right? And then teaching people, you don't have to hold this upright position, right? It's just little things after this, like let's do some band pull aparts and
Yeah.
do it specific to you versus like the Joe Schmo in the gym just throwing some bands around. There's all like, you can be supportive to surgery, you can be supportive to injections. You can, I look at injections as a way to clear out the pain, so you can open the door to rehab.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanethealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanethealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on premium intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes. If you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massage or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. So talking about the importance of all of this, let's say that I'm a patient coming in. What is the experience like at your clinic? How does your staff, how do you work with patients coming in?
So I'd like to argue that we have probably the most friendly like reception staff. Like our office manager is super awesome, and we like to when you come in, like you feel kind of welcomed and like you can. Eventually you just give crap to each other, like, between patients, staff. And so we like to have a good time here. So you immediately get in and feel welcomed and like, oh, this is like a place where everyone's friends. So like depending on, we usually prefer our chiros are kind of the main point. We kind of like to take the head of, we'll direct your care for you, and then whether you need massage therapy, a session with our athletic trainer, or the gym. We do a lot of personal training and a lot of rehab in there. So the chiros will kind of dictate the care, as well as our athletic trainer. You can see him too. But so typically we'll go through a session here and then kind of go through an analysis of how you move, what you need. If there's a strength issue, we can direct you to like, hey, like let's do a couple sessions of rehab with our athletic trainer. You need more glute stability. Let's go through a couple sessions with that, and then we'll follow up with a chiro in like 3 weeks.
It is so cool that you have that you can find all of those services under one roof and that you don't
Right,
have to be like going to like
going
7
around
different
places.
providers who aren't really cohesively working together for your treatment. So that is very exciting and really cool that you guys have that.
Oh yeah, totally. It's just, and that was a big thing too. How many times have you? Well, my chiro's here, but my massage therapist is here, and then my personal trainer's here.
They're all doing
So
their own thing.
right, and they're each doing their own thing. They don't like to talk with each other, and seeing what that looks like. It's like, oh, we can all communicate. So, I can influence what type of training like this person does, and if I don't have time in my schedule to maximize soft tissue work for this patient, okay, well, I can fit you with me to do some of the rehab and like mobilization, but let's get in with the athletic trainer so you can finish up on some soft tissue.
So good.
So we keep the patient in mind, and it's definitely a catered program for you.
No, that's again amazing, and I wish it was accessible everywhere. So guys, if you're in the Spokane area and this is something that sounds like you could benefit from, which let's be real, if you're a human living just your day-to-day life,
Right.
everyone needs it. Everyone can
Get your
benefit from
movement
it.
checked out, right?
Yeah, no, that's so good. So we've talked about the movement portion. We've talked about, coming in and creating a custom catered plan to like get your body functioning and prevent all of those things down the line. But how about nutrition? Like, what about food? How do you build a base for you guys to be able to work with?
Right. So looking at just nutrition, that's always kind of like the which fad diets is it keto, is it Mediterranean, paleo? Like you have all these different options. It's finding one that's sustainable for you, right? The Whole30, like that's a great kind of detox. But it's like sleep. Find whatever position you can. So find whatever diet works for you, and definitely, I always tell people like we know a decent amount of nutrition where day to day stuff, but if you need help, get in with a registered dietitian. We use Fuel to Thrive. They're awesome, and they can build a custom care if you have intentions to do something with it. But day to day, like I keep it simple. Like enjoy your food, have it be balanced, less processed. Something that's manageable. It's okay to have that cookie. Like one cookie's not going to kill you, right? You don't want to create habits where you're going to force yourself to binge eat after because you crave it so much, right? If you like drinking alcohol, that's totally fine. We try to practice what we preach. So I'm not going to be like, don't go, have too many. we've all done that with like, so, don't, it shouldn't be stressful, right? If it's something as little as counting your macros, like, have a rough estimate, right? And try to follow that guideline. But it shouldn't be stressful. We're like, oh gosh, I'm force feeding a loaf of bread because I didn't hit my carbs for today.
Right.
So unless you're training something, that's where, okay, have someone on you for it because you're going to be your own worst enemy.
No, that's so good. And like you said, there's levels to it. So the basics, it's like you can get started. I mean, I think whether it's with movement or whether it's nutrition, like you can take yourself to a certain level by following the guidelines. And then after a certain point, when you're ready to like really optimize it, that's where it's really great to go in and see somebody.
Right.
Yeah.
Just keep it simple, right? Both movement and nutrition. Yeah, keep it simple. Try to follow a certain thing, and then, okay, you've mastered that. Let's go get some help and take it to the next
level. So is self-care a luxury or a necessity?
I wouldn't even say it's a luxury anymore. Like even, most people think facials are a luxurious thing. It's like, hey, I mean, how much stress are you dealing with your life, right?
Yes.
Being a parent now, I think all moms should get facials at least like once a month.
Every mom listening to this is like clapping.
Right? And it's like, hey, this is, try to do that. And same thing with massages. Massages are viewed as a luxury, right? Oh, you're just gonna go relax. Like, not the massages here. We're trying to get some work done, but it's a combination.
Body work is like just taking care of your vessel. Like, how are you gonna make it to 80? How are you gonna make it? How are you gonna live your life? How are you gonna be the parent? How are you gonna be the partner? How are you gonna be the friend? Our world is starting to remind me of Wall-E. I don't know if you've seen the little animated cartoon where they're all sitting on their chairs.
Very familiar with Wall-E with the toddler.
I know, and it's like if you ask people to like, some people like just don't even have the mind-body connection to be able to like play catch, which is
or ride a bike, right?
It's so sad. Like we were meant to, and then it's like, well, I truly believe there is a correlation between the anxiety, between the depression, between the mental health and all of this stuff, because it's like, well, I'm not even occupying the body that I live in, and I end up in this like super disassociative state. It's just so sad. It's so sad.
You get caught up in all these different things of like work.
Yes.
Friend groups, like, and so it's easy to get caught up. But I tell every parent, tell myself this, and I'm still practicing it. But you can't take care of other people if you can't take care of yourself, right? And so, just taking that and thinking about it, it's like it's not a luxury anymore; it's a necessity. And like the frequency of like what you can allow for your time, it's like just not that you need to make time for body work or anything like that, but make time to stretch. Take time for yourself to like do something for your body. If it's a 30-minute walk on your lunch break, you can eat while you walk. Do something moving, right?
So good. Dr. Justin, I have loved talking to you, and I feel like, sometime if you're ever interested in coming back on, I feel like we should totally just dive into like one of these sections like in depth, because there's so much to explore here. And we end every episode with a challenge and a practical tip. So if someone listening to this episode only does one thing, what would that be?
I try to tell this with all my patients, even if they're, especially the ones that don't make time for them to work out or move, 1 to 2 days a week, do something active, right? I think I just talked about like going on your lunch break and, having lunch on a walk, or go outside and do it. Do something out of a normal routine that you feel normally would give like you, that would make you feel guilty, right? So if you're at work, go on a 30-minute walk, do something active for yourself. Or hey, 2 days a week for the next 2 months, like make time to go stretch before bed, right? 5 to 10 minutes. If you have a foam roller, put it next to your bed. You can lay on the ground and do the foam roller. If you're down there, you might as well do some cat cows, like, some bird dogs, just get you moving. So prepping your body for a good night of rest. So try to do something 1 to 2 times a week. Mm-hmm. And it doesn't have to be in the gym.
Yeah. No, and I think the hardest part is getting started. And I really love what you said about like leaving the foam roller next to your bed. Or for me, it's like laying out my tennis shoes like the day before and like my
Yeah,
workout clothes. It's like make it as easy, make the barrier to start as easy as possible so that
totally.
the best routine is the one you do.
Right,
Yeah.
right, exactly. Like anything in life, you just got to start.
So good.
Right.
So good.
So,
Yeah, well, if people are wanting to come in and see you, are you taking new patients or taking new athletes? And how do they find you?
so we're over by, so we're in the Core Institute building. We're over right across the street downtown from the Spokane Eye Clinic on Fifth and Bernard. You can find us on Instagram. I think our handle. I'm old now. It's like Instagram handle is it's built to move Cairo. Uh, and then I don't even know if we have Facebook right now, but yeah, check out the Instagram.
Perfect.
Well, I'm sure we'll have a link up there or something.
Yeah. Check the
But
description of the episode, guys, in the show notes. We'll have, and follow us on Instagram as well, and we'll tag them there. But thank you so much for coming on. I really enjoyed talking to you. So.
no, that was great. Thank you so
Yeah.
much for having me. This was fun.
Yeah. Guys, be sure to follow us on Instagram and send us your questions. We really love having this be a conversation where you ask your questions, we find the right experts to interview to answer them. So, also be sure that if you enjoyed this episode and you feel like you learned something or it made your life a little better, please leave us a review and share this with a friend. And we'll see you guys next Friday at the Real Wellness Podcast. Bye.
Thanks, guys.